Have you regained 5, 10, maybe 15 pounds after bariatric surgery? And now you're wondering, is this the beginning of gaining it all back? First, breathe. Small weight fluctuations are normal. Significant weight regain after bariatric surgery does not happen overnight. It happens gradually. And most importantly, it happens when your daily structure disappears. Today, I'm walking you through the prevention framework. This is the framework used in high-performing programs to help patients protect their long-term results. Surgery is powerful, but success is behavioral. Behavioral success requires structure. Let's start by understanding what is actually normal versus what is a warning sign. After bariatric surgery, weight loss happens in phases. Phase 1 is the rapid loss during the first 6 to 9 months. Phase 2 is where the loss begins to slow down. This is where many patients start to feel anxious, but it is expected. Phase 3 is stabilization. This is when your weight finds its new biological set point based on your anatomy and metabolism. Phase 4 is long-term maintenance. This is the rest of your life. During this phase, fluctuations of 3 to 7 pounds are completely normal. Those small jumps on the scale are often not fat regain. They are physiology. Let's look at the drivers of these fluctuations. The first factor is hydration. Changes in water retention can shift your scale weight by several pounds in a single day. Next, hormonal cycles. Hormones control fluid balance and inflammation, both of which impact the number on the scale. Sodium and carbohydrate intake also matter. Both cause your body to hold on to extra water temporarily. And don't forget stress. Chronic stress increases inflammation and cortisol, leading to temporary weight spikes. So, if those are normal, what is true regain? True regain is a consistent upward trend over 3 months or more. Watch for that trend. If the line is constantly moving up, even slowly, your behavioral structure might be weakening. The most common cause is the loss of dietary structure. When you stop planning and start winging it, regain follows. The return of grazing patterns is a major warning. Small bites throughout the day bypass your surgery's restriction entirely. Reduced protein intake is another critical sign. Without enough protein, you lose muscle and your metabolism slows down. Finally, a decline in activity. Movement is essential for muscle preservation and metabolic health after surgery. Early recognition is everything. The sooner you see these signs, the easier it is to correct the course before significant regain happens. Use data to your advantage. Track your weight, but focus on the monthly average rather than daily spikes. Look at your progress in 90-day windows. This filters out the noise of daily life and shows you the true state of your results. Long-term success isn't about motivation. It's about discipline and the systems you build to support your new life. Your success system should include meal prep, consistent hydration, and scheduled movement. These are non-negotiable. If you see the warning signs, reach out. Your bariatric team is your greatest resource for recalibrating your structure. In our next video, we will dive deeper into why weight regain happens and the specific metabolic factors that play a role. We'll talk about the metabolic factor nobody talks about, survival biology, and how your body adapts to weight loss. And we will explore why protecting your muscle mass is the single most important strategy for long-term weight stability. For now, remember, understand your phases, respect your physiology, and watch for the consistent trends. You have the tools. Now, build the structure to protect them. This is Volume 1 of your Bariatric Masterclass. Subscribe to follow the rest of this series and get structured, evidence-based guidance for your post-op life. One quick tip before we go. Always eat your protein first. It keeps you full longer and protects your lean muscle mass. And stay hydrated. Sipping water consistently throughout the day prevents dehydration-induced hunger cues. Prioritize sleep. Poor sleep disrupts hunger hormones and makes it much harder to stick to your dietary structure. Aim for 10,000 steps a day. This non-exercise activity is a powerful way to keep your metabolic rate elevated. Join a support community. Sharing your journey with others who understand the challenges makes long-term success more likely. Thank you for watching. I'm here to help you thrive. See you in the next volume of our masterclass. Goodbye. Remember, this information is for educational purposes. Always consult your bariatric surgical team for personalized medical advice. This series is brought to you by Bariatric Surgery 360, protecting your health one structure at a time. Stay focused. Welcome back. In Volume 1, we learned to identify regain. Now we must understand the why. Why does the weight start to creep back after such a powerful surgery? The most common belief is that the surgery failed, that the pouch stretched. While possible, it is almost never the primary driver of regain. The first major driver is the loss of protein focus. In the early months, protein is a priority. Over time, it often slides. When protein drops, your body harvests amino acids from your muscles. Less muscle means a slower resting metabolic rate. You burn less, even at rest. If you aren't hitting your protein threshold daily, you are effectively downregulating your own metabolism every single day. The second driver is grazing. This is the silent enemy. It doesn't feel like much because the portions are so small, but 8 to 10 small bites throughout the day can equal an entire extra meal. These small amounts bypass the anatomical restriction of your pouch. Grazing usually happens when we are distracted by work, screens, or stress. When you stop intentional eating, you stop metabolic control. Third, liquid calories. This includes specialty coffee drinks, large smoothies, and alcohol. These are metabolic hazards. Liquids pass through your surgery almost instantly. They do not trigger the stretch receptors that tell your brain you are full. You get the calories, but no fullness. Alcohol is a double impact. It is high in calories and it lowers your inhibitions, making a grazing episode much more likely. Fourth, emotional eating. Bariatric surgery operates on your stomach, but it does not operate on your emotional triggers. Without new coping strategies for stress, many patients return to carbohydrates or alcohol as a way to regulate their mood. This is a behavioral drift. This is why psychological support remains critical years after surgery. If emotional patterns resurface, address them now, not after 30 pounds. Fifth, the loss of follow-up. Patients who attend regular appointments have significantly lower regain rates. Period. The most dangerous pattern is avoidance. Patients regain a few pounds, feel embarrassed, and avoid the clinic. That is when the real gain happens. We are here to help, not to judge. Early correction is simple and often just requires a minor structural adjustment. Sixth, a decline in physical activity. Movement isn't just about burning calories. It is about signal sending to your muscles to stay active. Without resistance training, your body will shed muscle during fluctuations, which permanently lowers your metabolic floor. The good news? Your anatomy still works. The tool is intact. It simply needs the behavioral structure to be rebuilt around it. Review these 6 drivers. Which one has started to slide in your own routine? Identification is the first step toward correction. Remember, regain is just a signal. It's your body telling you that the structure has disappeared. It is not a failure. In our final volume, we will reveal the complete 3F framework to lock in your results for the rest of your life. We'll cover the specific structural strategies for food, fitness, and follow-up that the world's most successful patients use. Subscribe to finish this masterclass. Protecting your results is just as important as achieving them. I'll see you in Volume 3. Stay structured, stay successful. This is Bariatric Surgery 360, protecting your health, one structure at a time. One quick bonus tip. If you must snack, make it a structured protein snack. Never snack mindlessly from a bag or box. And remember the 30-30 rule. No drinking 30 minutes before or after your meals. This maximizes your surgery's restriction. Your pouch is small, but your habits must be big. Focus on the behavior, and the anatomy will take care of the rest. Reach out to your community. Sharing these challenges makes the behavioral correction much easier to sustain. This series is designed to help you thrive. Consult your bariatric team for personalized medical advice. See you soon. Thank you for watching Volume 2. Rebuild your structure and take control of your journey today. Goodbye. Welcome to the final volume of our masterclass. We have explored the what and the why of regain. Now, we build your lifelong shield. Maintaining weight loss is a completely different skill set from losing it. It requires a permanent biological structure. Your body is biologically programmed to defend its weight stores. After surgery, hunger hormones naturally increase to trigger regain. Your resting metabolic rate also decreases as you lose weight. Your body becomes more efficient, meaning you burn fewer calories daily. This is not sabotage, it is survival biology. It means you cannot rely on intuition. You need a medical strategy. This is why muscle mass is your most critical metabolic asset. Muscle tissue is metabolically active. It burns fuel even when you sleep. If you lose muscle mass during a weight fluctuation, your metabolism floor drops, making significant regain almost inevitable. To protect your results, you must protect your engine. This requires two non-negotiable behaviors: high protein and resistance training. Cardio is great for the heart, but resistance training is what signals your body to keep its muscle mass. Aim for 2 to 3 sessions weekly. You also need protein density. Every meal must start with protein to trigger satiety hormones and repair tissue. Now let's detail the 3F framework, the structural foundation for every high-performing post-bariatric patient. Pillar 1 is food. This is about structure, not restriction. 3 planned, protein-focused meals with 0 grazing in between. Avoid slider foods, processed carbs that dissolve quickly and bypass your pouch's restriction entirely. They are metabolic traps. And remember, liquids do not trigger fullness. Specialty coffees and smoothies add massive calories with 0 satiety. Pillar 2 is fitness. This isn't about extreme workouts. It's about metabolic signal sending through movement and resistance. Prioritize NEAT, non-exercise activity, thermogenesis. Your daily steps and standing often burn more than a 30-minute gym session. Pillar 3 is follow-up. The data is clear. Patients who stay connected to their clinic have the lowest rates of regain. We monitor your labs, protein, B12, iron, to ensure your metabolic engine has exactly what it needs to function. Follow-up also provides the psychological support to manage stress and emotional triggers without returning to old habits. Accountability is your ultimate shield. It catches small behavioral drifts before they become 20 or 30-pound problems. Never ignore sleep. Poor sleep disrupts your metabolic hormones, making it nearly impossible to stick to your dietary structure. Chronic stress elevates cortisol, which signals your body to store energy around the midsection. Stress management is medical care. So, what if you have already regained? You must recalibrate immediately. Do not wait for the weight to go away on its own. Use the 5-pound rule. If you see a consistent 5-pound jump past your stable weight, it is a signal to rebuild your structure. Step 1. Re-engage your bariatric team. There is no room for shame here, only science and support. We are your partners. Step 2. Resume tracking. Protein intake and hydration are the first habits to slip and the first we must rebuild. Shame is the greatest enemy of long-term success. It keeps patients away from the clinic when they need us most. Please, reach out. Your surgery is still a powerful tool. It hasn't broken, it just needs the right behavioral structure to be effective again. Take control of your environment. If trigger foods are not in your kitchen, they cannot trigger a grazing cycle. Structure starts at home. Set boundaries in social situations. You are protecting a life-saving medical intervention. That protection is your top priority. Think in decades, not weeks. Your goal is a lifetime of metabolic health and high energy. That requires a decade-long mindset. Maintenance is a marathon, not a sprint. Pace your habits, trust your structure, and lean on your clinical team. Success is behavioral. Let's recap our journey. Recognize the signs, understand the drivers, and build your 3F structure. This is the blueprint for thriving. Food first, fitness always, and follow-up forever. That is the secret to protecting your bariatric results for life. Every day is a new opportunity to rebuild your structure. One bad day doesn't define you. Your long-term patterns do. If this masterclass helped you, subscribe for more evidence-based bariatric guidance. We are with you for every step of this journey. Protecting your health is a lifelong mission. This is Bariatric Surgery 360. Stay structured, stay successful. Thank you for joining this masterclass. You have the tools, you have the knowledge, and you have the power to thrive. Goodbye. Always remember, this information is for educational purposes. Consult your specific surgical team for all medical decisions. Bariatric Surgery 360. Protecting your health, one structure at a time. Join us for more deep dives. Stay focused.